Let's cross over to Kisumu County, where it is looking at an impending crisis in the health sector as the health workers plan to withdraw their services tomorrow.
The workers encompassed under the Joint Health Workers umbrella are demanding their January salaries, accusing the county government of failing to keep their end of the bargain after several negotiations. Laura is telling us more. She's joining us from Kisumu. Laura, if this strike does go forth tomorrow, just what is Kisumu looking like in terms of its health sector?
Well, indeed, Zinzi, Kisumu has been struggling for some time in matters health, where residents have been forced to look for health services in private facilities. Others have been forced to travel to neighboring counties so as to seek those health services. It is not really doctors that are going on strike, but an umbrella of health workers encompassing nurses, clinical officers and lab technicians, and they are demanding their January salary. Remember, last year there were a series of strikes from those groups of health workers where they were calling for an array of reforms in the health sector, including the improvement of their work conditions, as well as upscaling and the promotion of the various health workers to their specific job cadres according to their educational levels. So, of course, it's not tomorrow, but today that they're expected to converge here at the governor's office to present their memorandum and to be given a way forward, because what they're claiming is that the county government had promised an array of reforms in that sector, but they have failed to so far implement even one of those things. I remember last year when the governor had called for a press conference, he had indicated that he was aware of the chaos that are rocking the health sector, and he had indicated that there is a specific implementation matrix which he was trying to follow in order to bring a consensus between his side of the, can I call it a tug of war, and the side of the health workers. But then we have seen a number of strikes across this place, and as usual, it is residents that are forced to dig deeper into their pockets. Remember, Kisumu County is one of the counties that was piloting the UHC program, and it had garnered some sort of a success because residents were really praising it. But remember, now in the face of the national rollout, there are certain matters that the county government needs to look into, and the matters of personnel was quite high on that list in terms of ensuring that the doctors, the nurses, the midwives and all the people that are encompassed in the health workforce are well catered for, to ensure that there is seamless service delivery to the residents of Kisumu. So we're still waiting. They were supposed to converge here by 8 a.m., but some of them are informing us that they are still grouping so that they can come here as a big group for their voice to be amplified. But then some of the questions that we will be seeking to ask is how they intend to push the conversation forward, because it seems to be an ongoing conversation, year in, year out, strike notices being issued, strikes being called off a day to the actual day of the strike. So, of course, we will be seeking to talk to the governor and the health workforce as well to see if they have permanent way forward to ensure that service delivery in the health sector in Kisumu will be seamless across the county for the benefit of the residents of this county, Zinzi.